It's important to have a forensic medical examination for lots of different reasons, and those reasons will vary with each individual person. We want to look at the healthcare needs of the person as well as the forensic. So here we are in the forensic medical examination suite. What we would be doing is looking to see whether the person's got any injuries, and if they have, we'll be attending to those injuries. We also want to reassure, so a lot of people will have concerns about what might have happened to them, so we'll be listening to those concerns with people. The other would be the forensic medical examination, so documenting injuries for the purposes of an investigation, because that might be evidence in a court case later on. So in terms of some of the healthcare needs, it might be someone's worried that they're pregnant. We can do a pregnancy test for that. We've got emergency contraception, so we can give that if it's needed. They might be worried about HIV, so we'll do a risk assessment for HIV. We've got medication we can give for that. Hepatitis B, so some people might be concerned that they might get hepatitis B infection because of what's happened. So again, we'll do a risk assessment, and we've got medication that we can give for that as well. For some cases, we might be doing screening for sexually transmitted infections. So we would do that if a sufficient time period, usually at least 2 weeks, had gone from the assault to when we examine. So we don't do that in every case. Again, for each case, we'd be listening to the person, what's happened to them, what time has passed, what are they concerned about, and responding to each person. We're not going to do anything that the person doesn't want us to do, and we'll be explaining everything as we go along. And at any point, people can say, no, stop, I don't want this. We're always listening to what people want. So we've got some of the equipment here. I'm in scrubs because we're worried about contamination of DNA. So that's why we wear scrubs and why we'd be wearing gloves as well. We've got various bits of equipment. So we've got things to look in people's ears, to look in people's eyes, stethoscope, which people will be familiar with. There's the examination couch. Again, people will have privacy. We've got the curtain, we can pull the curtain around. People don't have to undress in front of us. They'll be covered at all times. If we're looking at different parts of the body, we'll just take one arm out at a time and then the other arm. We give control to them. People will explain, I want to do this because of, and they can agree or disagree to each particular part of it. We've got a colposcope, so this is quite an important piece of equipment, and this basically is just a very bright magnifying light, and when we're doing different parts of the examination, we'll be using this. Images will come up on the screen. We'll be taking forensic samples, but again, this is nothing to worry about. It's just basically like a cotton wool swab, and we'd just be putting a little bit of water on this and then just swabbing gently the different areas of the body where we might be looking for trace evidence and putting it in one of our evidence bags. We would be making notes as we go through the examination. So the doctor will be writing, but again, the doctor will be explaining what information they're gathering and what they're writing. The examination will take quite a while. On average, they would be here about 3.5 hours. Not in this room all the time, but it is quite a long period of time. But I suppose the main message to get across to people is that they're the one in control. It's the person coming for the examination who chooses what happens and what doesn't happen. And we try and make the experience as best we can for them.